Yes? All right. Sorry, I'm having real technical difficulties. Bear with me. Where are we? Okay. All right. We can all see this. You can all hear me. Excellent. Okay. Skeletal system and pathologies, right? Let's talk about this. So super duper important here, your bones are living tissue. We are used to seeing bones in their dead form when you're out hiking or something and you see, white, chalky bones out there. Those are dead bones. That's like looking at a dried leaf and thinking you understand a tree. So they are actually living tissue. They're quite porous, which means they have pores in them and holes in them because they need blood supply. They actually need blood supply to feed the cells that make up your bones. They change depending on your activity level. So taking things like calcium supplements does you really no good if you don't do weight-bearing exercise and such, because your body needs a signal that they should build up bones. So, and people that do certain types of exercise, I mean any type of exercise, the bones that are utilized in supporting that exercise tend to get thicker. So if you are somebody who does something with your arms all the time, your arms bones will get thicker. If you're somebody who does something with your legs all the time, your leg bones will get thicker. It's even more dynamic than that though. They will actually build up strength directionally in the way that force goes through that bone. So we will actually see the matrix that makes up your bones, which is a fascial matrix filled in with stuff. We will see that matrix shift. If the bone takes force straight on, we'll see the matrix is kind of lined up and down. If people take shear stuff, if they're doing lots of lateral movements, we'll actually see the bone strengthen in a lateral fashion. So it doesn't just get thicker in areas where you're using it. It gets thicker in ways that you specifically need to handle the directional forces that you specifically go through. They're highly dynamic. They're breaking down and building up all the time in your body, constantly. And they're constantly changing depending on your needs. There's about 206 bones. We've talked about this before. You probably start out with 300 or something. They start out as cartilage and then they slowly formed into solid bone. Osteo means bone. Don't forget that, because osteo is something that you will see utilized in lots of other words. And anytime you hear blah, 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 osteo, they're talking about bones. And it gives you a real quick clue to what a word means, just if you even just remember the fact that osteo means bones. Yes, Miss Young, please.
Actually, when I was looking for like a mapping answer yesterday,
yeah,
and they were asking about what I think destroys bones, I literally looked in the suffix and just looked up what was bones, and then I found it really easily.
Yeah, I believe that. Yeah, exactly. Very cool. Probably found osteoclasts.
Yeah.
Yeah, very good. Cool. And it's bones, right? Bone destroyer. It's actually it's cells that destroy bone. For a good reason, by the way. These aren't bad. Very cool. Thank you, Ms. Young. The anatomy, remember the parts that make up your skeletal system. The parts that make up your skeletal system are your bones, cartilage, and the reason they're putting cartilage with bones is because there's cartilage associated with bones. There's not really cartilage just floating out around in your body. There's cartilage on the ends of your bones and between some of your bones, so they put it in the skeletal system, even though they are not bones. And then joints and ligaments. Joints obviously are in the skeletal system because they connect bones together. They're your hinges and your ball and socket joints and your all that kind of stuff. Why are ligaments, which are purely fascia, in the skeletal system? Anybody? Mr. Overman, please.
Because they attach bone to bone.
Thank you. They attach bone to bone. Ligaments attach bone to bone. That's exactly right. Yeah. And so they put them into the skeletal system, even though, by the way, if you looked at a ligament by itself and you looked at a tendon by itself, you would not be able to tell the difference. They're both fascia. But we throw tendons in with the muscular system because they attach muscle to bone. So this is about people like you and me categorizing very complicated stuff in the body for convenience. As we're going to see, the skeletal system, like all systems of your body, tie in intimately with all the other systems of your body. One could not exist without the other. Not even a little bit. These are just good prefixes and things like that to know. Arthro means joint. So osteoarthritis is, inflammation of your bone joints, right? Anything that has itis on it, don't forget, anything that has itis on it, anything that has itis on it. You've got teacheritis, I'm causing you inflammation, right? Anything with itis has inflammation. Periosteum is also another really good word to remember because the periosteum is the fascia around your bone that your tendons actually attach into, and we will get to that. And then the skeleton that we're normally used to seeing, like the skeleton here in the class, this is not a real one, is dried up bone. It's not living bone anymore. So it's actually lacking a lot of these things that we're going to be talking about today. What is the physiology? What do these parts do for us? They obviously provide support. They're the reason you can sit upright in your chair right now, that you don't look like a jellyfish. They provide protection against impact, especially your rib cage, right? Your rib cage is protecting your heart. We really care about this movement. Now, your bones don't move you, but they are the levers that, along with your muscles, move you. Your bones are your levers of your body, 100%. This is the other fascinating thing. They produce red blood cells and white blood cells. So I've said this before, but it's kind of fascinating that these things that hold your body up, act as your levers for movement, are producing blood inside them, the very blood you need to live. So the very blood they need to live, too, that's kind of ironic, by the way. They produce red blood cells that leave your bone, go into your bloodstream, go up to your heart and lungs, get fresh oxygen, and bring it back to the bone that made it. So they make the very blood they need to get the very oxygen they need and to get rid of the very carbon dioxide they don't need. Carbon dioxide is actually poisonous to the body over time. And they make the very stuff they need to carry those nutrients back and forth for them. And for the rest of your body, too. Everybody needs it. Every place in your body needs it, but it's kind of fascinating. So this is what I meant about systems of the body. This is a really simple example, but don't forget we chopped these systems up to understand them. But why isn't the skeletal system in with the cardiovascular system? My God, it makes the very blood that the cardiovascular system carries around. Of course, you can't have a skeletal system if the cardiovascular system isn't picking up oxygen, letting go of CO2. So we had to just start chopping stuff up to try to understand it. Yes, Ms. Creel, please.
Just to understand, so the skeletal system is the one that's producing the red blood cells, and that's why it's not part of the cardiovascular system?
Yeah. I mean, short answer is yes. It's because that's where we decided to we had to divide somewhere, right? I don't mean we, none of us did this, but somebody came along and said, hey, the human body is really complex. Let's look at these huge systems that seem to work. I just want to remind us all that these systems aren't separate at all. Somebody came along and said, yeah, we know the bones produce blood, but we can't put them in the cardiovascular system because we really got to talk about the bones over here and about how they do all this other stuff. But they do make blood, right? And so, yeah, that's exactly right. It's an arbitrary division that somebody made for understanding. And I'm making such a big deal out of this because towards the end of this course, we're going to be putting stuff back together, and we're going to realize that lots of unintentional lies were told us. And I don't really mean lies, but for understanding things were overly simplified and that we need to put them back together. So that's why I'm making a big deal out of it. But yeah, you're absolutely right. Bones also actually, your bone marrow not only produces red and white blood cells, but it can also store fat, which is really important, by the way. We all live in a country actually that has just an abundance of food. It's really crazy, and so we don't think of fat storage as being really crucial. But if you didn't live in such a place like this, your body is constantly trying to keep storages of fat and backup energy, because if it runs out of energy, you die. So your bones can store fat and minerals, by the way. So if your body does get low on calcium and it's not getting enough, one of the places that's going to go look for calcium is its biggest calcium deposits in the body, which are your bones. It will start to take calcium from your bones because that's where it's got it stored. It's got to take it from somewhere. Okay. Yes, Miss Creel, please.
Wait, can you go over again where it takes the calcium? Is it just from the blood? I'm sorry, I kind of missed that.
It's okay. Bones are essentially made out of calcium and potassium in a fascial network. So in this kind of fibrous network. But so there really is calcium in there, and your body can literally go by and use osteoclasts and start breaking apart bone, and it'll go in the bloodstream, and it does that, and it can utilize it in other areas where you need calcium. And we don't just use calcium for building bone. Calcium ions have a charge to them, and you don't need to know about all this, but they have a charge to them, and you actually use calcium in firing your muscles and things like that. It's one of the neurotransmitters you have that help send essentially an electrical signal to your muscles to operate and things like that. So a lot of times people are talking about replacing your electrolytes. They're talking about putting back in ions into your system so that you can fire your nerves properly and all that kind of stuff. But anyway, calcium is one of the things that helps other areas of your body function properly and keep you alive. And if your body doesn't have enough, it's smart enough to go, let's go check out the femur. Because there's a lot of calcium there. And it'll break it apart. And everything it breaks apart, by the way, just goes back in the bloodstream, and it goes all around your body. And other areas that need it, pick it up. It's not like your body sends it to the, to the left bicep. But it sends it into the bloodstream, and it goes around, and the left bicep sees it going by, and it needs calcium, it grabs it.
All right. Awesome. Thank you.
Thank you.
Clarification. Thank you.
No, thank you. I probably need to give clarification. Okay, so don't forget this. Bone is in a connective tissue matrix. There is this matrix of fascia, and it is filled in with calcium and potassium that makes your bones so rigid, and also gives them a little bit of flex. Miss Clayton, I thought you raised your hand. Yes, ma'am.
What is an ion?
An ion is a negatively charged atom. Yeah. And wish my father was here right now. He's a chemistry professor. So growing up with him, he could just explain all this stuff to me. But your body uses negatively and positively charged atoms to, because they attract, by the way, opposites, to send chemical messages and to conduct electricity essentially in your body, to send messages down your nervous system and get it to your muscles. Yeah, and other places. And so that's a very important part of how you work. Yeah. And because it's the charge that matters. It really is. That's what makes them grab onto their stuff. Okay, so your bone is this connective tissue matrix. And that, by the way, also allows it to be hard and a little bit flexible. Your bones do flex. Not a lot, but they do, and you want them to flex. Like a strong tree, you want them to flex in the wind. So because you've got this rebar in with this concrete, they have a little bit of movement to them, which is really, really helpful. Less and less the older you get. When you're young, it's really flexible because there's more fascia in there and less hard bone. And that's good too. It kind of makes you kind of bouncy. So you don't have to memorize this. You don't have to go into gory detail about this. But what we want you to realize is the bone is essentially hollow on the inside. By the way, it's full of marrow, and it's, producing red blood cells and things like that in there. But it's also porous in many parts, which means it's kind of spongy too. And all this is to save weight. So Mother Nature, God, somebody was quite brilliant when they built your body, and they had a lot of problems to solve. And one thing is you want somebody very strong, but you don't want to build a tank because then you can't move fast. And so you had to build these very strong kinds of levers inside your body. And one of the ways you save weight on things is to have them hollow on the inside. So actually, in a really real way, your long bones actually are kind of like tubes of metal, and they are hollow on the inside. They're full of stuff, but I don't mean they're full of heavy stuff. They're full of fatty tissues and stuff that help form blood and help store minerals and fats and all sorts of stuff. So all this is just to save weight and to still keep your strength. And that sponginess there is the matrix filled in with all these all these minerals I've talked about. So there is a matrix there that's kind of creating that spongy thing. That's why it looks like a matrix when you look at it. It looks like a spidery web kind of thing. Super cool stuff. We, by the way, have our skeleton on the inside of our body. Little bugs have their skeleton on the outside of their body. They have an exoskeleton, right? So they don't have bones on the inside. It's their hard shell and their hard legs on the outside that actually protect them and give them support just like a bone. The problem with that model is it works really well for a cockroach, but if you expand it to the size of a human being, you'd weigh 1,000 pounds and you wouldn't be able to move anywhere. So having your skeleton inside your body does not give you protection like an exoskeleton does, but it makes you a lot more mobile and a lot better at moving around and all that kind of good stuff. We don't have to go into all that. Let's talk about bone cells, though. So you basically have two important bone cells. Osteocysts are just bone cells. They're just bone cells being bone, being cool, hanging out. Remember, a whole bunch of cells put together make tissue. A whole bunch of bone cells put together make bone. They're inside a fascial network, but they make bone. But then you have these things called osteoclasts and osteoblasts. And B should make you think of bone forming. It shouldn't make you think of that, but it might help. Osteoclasts actually break bone apart, and osteoblasts build it back up. And this is important. It's not that osteoclasts are bad. Not even a little bit are they bad. You are doing what's called constant remodeling. So your body comes along and is constantly looking for areas of minor fractures, and these could be microscopic fractures. And it's constantly kind of breaking that stuff down and building it back up. And in areas of high stress where it sees stuff, it tends to break it down and build it up thicker in that area. And so this is how your body is responsive to your stresses in your life. So when you've done an activity, some athletic activity for 5 years or something, your skeletal structure is very designed for that activity at that point. Your body has been breaking down and building up bone in such a way that it really supports the stresses that your body goes through. So you don't have to get all into this. It's just that you have cells that break apart mature bone and then cells that build it back up, and all of it is for remodeling. It's for repairing and building up stuff that needs to be fixed and such. So, yes, Miss Creel, please.
I was trying to think of a way to separate the osteo bone types, and I think what you said with the osteoblasts for B for bone foaming, I was thinking osteocysts as an assist them to mature the bones,
Yeah,
how
sure.
a parent would, and osteoclasts for bone destroy is like class makes me collapse.
Yeah.
Makes me think collapse.
Good. I like
So
it.
maybe that would help.
I like it. Yeah. Well done. Mr. Overman, please.
The book had a good way too. It said think of blast B as build, blast build, and then C classed was crush.
I love that. That's fantastic. I shouldn't even say this out loud, but my problem with it is blast makes me think blow up. And so I'm honestly like, darn you guys, like blast aren't they going in there and blasting? And it's the exact opposite, but that's so stuck in my head and I know it's wrong that's how I remember. I'm like, it should be the other way. But yeah, that book's got a great way of doing it, yeah. I don't know who names this stuff. Ossification. I just want you to know what the word means. I've actually talked to you about it. But essentially, you start out as little cartilaginous fibrous, being inside your mom's tummy, and you slowly fill in with calcium and potassium and kind of concretize, which is actually a word, concretize, you become more concrete, which is ossification. So that network gets filled in with more and more stuff, and it's ossification, and it's the process of bone actually being built in this network. It's ossifying. It's ossification. It's just a good term to understand. And when you break a bone, by the way, if you have a clear break on a bone and they x-ray it and stuff, what you will see is you'll see the fibrous network grow back together first, and then you'll see it fill in with calcium, potassium, and become solid bone. But the connective tissue actually comes back first, and then it ossifies. So that's a really good example of ossification. And this is all about bone remodeling, as I explained, right? All sorts of stuff can affect bone remodeling, but weight-bearing exercise especially affects how your bones build and how they're strong and where they're strong. Okay, there's all sorts of classifications of bones, and from a massage therapist point of view, knowing the names of these classifications to me is absolutely irrelevant. For example, a flat bone, a great example would be the scapula, right? But I don't understand why you have to learn that. You guys have all grabbed a scapula. You know it's flat. It doesn't change anything for you. We need you to actually know where the bones are and have actually felt them. So I will not be spending time on like long bones and short bones and flat bones and irregular bones. This is somebody naming stuff for their convenience. One you should know about, though, is a sesamoid bone. A sesamoid bone is a relatively small, sometimes super small, round, flat bone that is wrapped in tendon. And you have it in high-stress areas of your body. And I will give you a great example of one of the places that you all have it, your kneecap. You can move your kneecap around because it's actually wrapped in tendon that hooks it from the top of your leg, from your femur to your tibia, and it's considered a sesamoid bone because it's not really hooked to another bone directly. I mean, it is through the fascia and stuff, but it's there, by the way, just so you guys know. Your kneecap is there to keep your femur from sliding out over your tibia when you squat down, which would be no bueno if that happens. Really, really, really be bad. Miss Osuna.
Yeah, quick question. I'm not sure if you know for sure or not, but do you know if you have to memorize this for the NBLEX?
I don't know. I just don't know. But here's my thought, Miss Osuna. I appreciate the question, and you're right. I would, because here's the thing about taking the NBLEX. From what I've never taken it, by the way, but from what I've heard, the thing about taking it is you don't even need to know everything. You want to know what they're talking about quite often. And so the more knowledge that you have floating around your head, you can be like, oh, I don't know that, but I know what a flat bone is, and you must be referring to this, that kind of thing. So I do think it's very helpful to get as much of this type of general knowledge as possible to help you with the NBLEX. And by the way, the real thing, from my understanding, to focus on the NBLEX is pathology. So when we get to like what certain diseases of a system of the body are, things like that, pay attention to that stuff. Because the NBLEX has lots of questions about that. Yeah. And I will, you might have to remind me, Miss Osuna, but I will. We'll bring Miss Borish in to kind of help with that more as we get closer to the end too, to kind of maybe cover stuff that she felt was really, really key for the NBLEX. So sesamoid bone, your kneecap is a great example. You actually have 10 in your body. I just told you about 2 of them, which are your kneecaps. Along the way, we'll probably figure out what the other 8 are. Oh, Miss Everson, yes.
What's an example of an irregular bone?
Your wrist bones.
Oh, your carpals?
Yeah, they're all irregular. It's just a catch-all term, right? But like your long bones would be your femur, your tibia, your fibula, your radius, your ulna, your humerus, those are all long bones, right? Flat bones are things like your hips, believe it or not. I know they don't seem flat, but they're, kind of flat. Scapula is flat, and then irregular, yes, would be things like, by the way, even my little bones in my finger are long bones because they're longer than they are, they're long and skinny. But yes, irregular would be like your carpals are really irregular. They look like gravel in there.
What would your vertebrae be considered?
Irregular? He said guessing, not knowing the answer. Out of this choice, I would call them irregular. Yeah, I always just call them my vertebrae. Yeah. Quit asking me questions I don't know. Oh, hey! Look, I was right.
There you go.
Here's for guessing. Yeah. So, they're irregular, which makes sense because they're irregular. Yeah. All right, everybody. Okay. These are terms. Unfortunately, at this level of anatomy, we learn lots and lots of terms. The actual parts of the bone. The shaft of the bone. Bone's kind of got a shaft and two ends to it, right? Think of a dog bone, like a classic cartoon dog bone. The shaft in the center is called the diaphysis. It is wrapped in a fascial fibrous sheath called the periosteum. That is fascia. It's super important. It helps your tendons hook onto the bone. It also, by the way, contains lots of blood vessels and things like that that feed the bone. So it's living tissue that kind of blankets the bone and keeps it alive. Medullary cavity is really the hollow space inside the diaphysis where we said the bone marrow is. And that's where your red and white blood cells are produced. Just terminology. You'll have this on a test tonight or tomorrow night. Miss Hendrickson, please.
So the blood vessels and the nerves and stuff are on the outside of the bone, but inside of the periosteum? Like a sheath around all that?
The periosteum actually helps feed the bone, but they actually go through the periosteum eventually and get inside the bone completely. So you're right, it's very confusing the way they put it. The periosteum has a blood supply to it, but that blood supply actually goes all the way into the bone as well. The periosteum is kind of woven into the bone a little bit. They say it's a coating around the bone, but it's kind of like the fascial sheath around it. Anyway, it gives blood supply that helps the outside of the bone, but there's inside the bone too, and there's blood supply in there. For lots of reasons, by the way. One thing is the inside of the bone needs blood supply. No cells live without blood supply, but also the bone's making blood that has to get out.
Right.
And so it's got blood supply coming in and out. There's blood going everywhere. It's just a bloodbath in there. Remember epi? Do we remember epi from our layers of skin? Epidermis? Well, epiphysis is the ends of the long bones, right? Kind of like the tops of the bones. Yeah? Did somebody else raise their hand? Did I miss it? No? Okay. Make you be hungry, Severson. You don't have to stop. Epiphysis is the ends of long bones. There is something called Epiphyseal Plate. Again, this won't help your massage. This is just a little bit of general analogy thing. But if you've ever heard of a growth plate, that's what your epiphyseal plate is. And there is between the diaphysis and the ends of the long bone, there is, let me see if I have a picture of it here. There is a plate. No, I don't. Can't believe I don't. No? All right, we'll get to it. There is a plate where bone growth occurs. Essentially, bone growth occurs between the shaft and that. And by the time, if you're a girl, by the time you're about 18, that thing seals up and you stop growing. If you're a guy, it quite often keeps growing until you're about 25. Guys, we're slower. Let's be honest. I think you guys have figured that out. Yeah, by now. Anyway, so we keep growing a little bit longer. More important, though, to a massage therapist is articular cartilage. So at the ends of the epiphysis, at the ends of the bone, there is cartilage around the ends, and it's called It's called articular cartilage, but more specifically, it's called hyaline cartilage. It is this beautiful, light blue, like moon blue cartilage that's smooth as silk, and it's on the ends of the bones to help make sure that they don't rub against each other. It's very, very slick. We've already talked about the axial skeleton, the appendicular skeletal system. I'm sure the tests will ask you how many bones are in each. You'll never need to know that. But you do need to know that the axial skeletal system is what? What does the axial skeletal system consist of, Miss Hendrickson?
So it's the skull, the vertebral column, and the rib cage.
Yes, the skull, the rib cage, vertebral column, absolutely. And the appendicular skeletal system consists of what, Miss Hendrickson?
The appendages, so
Everything.
your shoulder, arms, and legs and hips.
Yeah, and that includes your scapula, and your hips, yes. All that stuff coming off. Appendicular skeletal system. And again, we kind of care about this as movement specialists because a lot of the problems that people have occur where their appendicular skeletal system attaches to their axial skeletal system, right? Think about when people say my shoulders are sore, they're really talking about where the scapula hooks onto their body. And you guys might have had low back pain, but I bet you've almost had hip pain before. You know that deep ache you get almost in your sacrum and your tailbone? That's really the attachment of all this stuff on there. And if you think about it, all your weight has to get distributed down through that stuff, so that's not surprising. So as massage therapists, we care a lot about where these things meet up. And here is a beautiful picture of the axial skeletal system, the appendicular skeletal system. Yeah. Okay. And this is a good place to take our 15-minute break. So there you have it. And getting them into your cars or other people's cars or whatever. Let's go on to talk about joints, really, and structure and function of your skeletal system. So, anywhere anywhere two bones come together, they call that a joint. They also call it an articulation. And that's an important word to remember because it's a word that we commonly use. We'll say, does this articulate here? Does it bend here? Does it move here? That's an articulation. Your classroom door, when you open it, articulates at the hinges that allow it to articulate with the wall via the hinges there. So joint and articulation are really the same thing. And almost every bone in your body articulates with another bone. They say here just the hyoid bone, which is the bone in your throat, but you've actually got three bones that we won't learn about that are inside your eardrum. It's hard to say if they exactly articulate with other bones. And you've got those sesamoid bones that we just talked about, like your kneecap. I don't know that your kneecap really articulates with their bones, but it is part of a joint, so maybe that's why they're saying that. Anyway, joints are articulations. Articulations are joints, and they're places where two or more bones come together. You've got three types of classifications of joints. We've talked about some of this before, but we're talking about it again. And these classifications are very much based on how much they move as well. So you've got fibrous, cartilaginous, and synovial. I want to start with the last one first to make a point. Almost every joint we are going to study in this classroom is synovial. It has a membrane around it. It has a little synovial membrane, remember, and it squirts out synovial fluid on the inside. It lubricates it, and it's why my finger, if you think about it, if this was my back, it'd be amazing. My finger can bend all the way over, and then some, it can keep going down, right? It articulates incredibly, and that's just with 2 or 3 joints. So that's a synovial joint. So are these, so is this. Most of what we think about in our bodies are synovial joints, except when we get to our spine. Our spine, we're moving up the list now, is a cartilaginous joint. It's cartilage between there. Super strong, by the way. Doesn't move as much. But we've already discussed this. The reason I'm able to kind of bend over with my back is because I have 24 of those cartilaginous joints all bending a little bit, and if they all bend a little bit, you get some movement. But can you imagine if I had 24 synovial joints back there? I'd literally be able to wrap myself around 3 times, right? So cartilaginous joints, super strong, but they don't move as much. And they don't have a synovial membrane, they don't have all that fancy stuff around them. And the back is, your spine is the best example I can think of for a cartilaginous joint. The best example I can think of for a fibrous joint, this is where the cartilage is so hard it hardly moves, would be in your skull. You've got little sutures in your skull, they're sewn together with fibers, and they say they don't move at all, but they actually do. They barely move. Ms. Dimitri.
What about like the contortionists who do those incredible bends?
Right. No, you're absolutely right. So what they've done is all sorts of stuff. They've been doing that usually since they were kids. They start training very, very early. Sometimes they are genetically predisposed to it. We have somebody in our classroom who can hyperextend really well. They just have looser joints and things like that. But even that said, a contortionist's back can't literally do what my finger just did. My finger can, do this incredible thing. And the contortionist is taking 24 joints. They do it better than I do with their 24 joints, but they're still not getting the type of movement out of those cartilaginous joints that you get out of your synovial joints. So I admit they can bend all the way in half and maybe even look between their legs and look up their backside, right? They can do some pretty amazing stuff, but it's still, my finger can do that right now. Like it can do all sorts, and it's just 3 joints working. They're getting the most out of those 24 joints. Yeah. And they've probably been stretching their whole life, so they're probably hypermobile. Sometimes being hypermobile is not a good thing, everybody. By the way, you'd like just like a door, you want it kind of hung, kind of solid. You don't want it drooping, right? But you don't want it so tight that you have to the hinges fight against each other. You want your joints to be the same way. You don't want them so loose that they kind of slide around too much, and you don't want them so tight that they don't bend and flex well. Boop. So I just said all this. It's a good example of a synovial joint here. Boom. So, you need to hear these terms, but you probably won't use them. So, synarthrotic, amphiarthrotic, and diarthrotic have to do with movement. Do you remember what I just said? These joint types have a lot to do with movement. Well, the fibrous joint is also a synarthrotic joint. Syn means without, by the way. So it's without movement. That's a fibrous joint. Amphiarthrotic has some movement. That's a cartilaginous joint. And synovial joints are diarthrotic. They're very movable. That said, I rarely hear massage therapists ever use these terms. They do talk about synovial joints, don't get me wrong, cartilaginous joints, but they don't talk about synarthrotic, amphiarthrotic, and diarthrotic. We just assume that stuff. We know synovial joints are highly movable. We know fibrous joints hardly move at all. We just kind of know that. It's kind of obvious. So let's talk about synovial joints. Boom, boom, boom. These are the ones we're dealing with most of the time. They all have a joint capsule around them, a synovial membrane around them. That joint capsule is made out of really thick fascia, kind of like ligaments. You've also got ligaments, these fascial ropes that tie bones together at a joint that just help give them stability and strength. You often have articular cartilage, hyaline cartilage over the ends of these bones inside the synovial membrane. And sometimes you have a labrum around them. A great example is the shoulder. Remember how the shoulder joint really doesn't have much of a socket? There's not much of a socket here. So you have a little labrum, which just means lip, a built up fascia around there that makes this more of a socket than it normally would. And you'll hear some people say, like, I dislocated my shoulder and tore my labrum. And sometimes they go in for surgery for that one because they want to clean up the little bits of cartilage kind of hanging off from the torn labrum. Synovial membranes secrete synovial fluid. Synovial fluid is the oil for your joints. That's it. That really is it. They prevent wear and tear. Yeah. How was that, Miss Rader?
It was, well, so I knew something was wrong for a long time, but I never went and got it checked out, just kept doing stuff, so I ended up actually having a stress fracture and a labral tear. So after the stress fracture healed, I went in for the arthroscopic surgery and had that taken care of, and it was fine. I mean,
Yeah, it's very.
the healing process.
My understanding from that type of surgery is pretty minor, right? They go in, they very tiny incision, and they zip some of that, and they're really just cleaning it up in there, right?
Yeah,
Yeah.
exactly.
Cool. Thank you. Yeah. So synovial fluid, by the way, I know I said it's just the oil for your joint, but also, by the way, it is bringing things that feed the cartilage in there, right? Everything in your body is living. And if you don't bring blood to it and nutrients to it and things like that, it will die. So this stuff actually also helps provide nutrients to feed the cartilage and such inside your joints so it stays healthy, all that good stuff. This is a great picture. This is a bone meeting another bone. It's got hyaline cartilage over the ends in case they do hit. It's got a joint capsule over it. It's full of fluid, and believe it or not, this is all under pressure in here, which helps keep the bones apart so they don't hit. It does have nerve and blood supply going in here. It has to. And all of this sews into the periosteum, which is the fascia around the bone. And of course, there's synovial fluid on the inside. And it's not purple in real life. Cool. Some other stuff that you will see associated with joints sometimes are fat pads that will fill extra space inside a joint to help things be padded and such. Bursa Sac, which one of you, I forget who, brilliantly told me that they're essentially like synovial joints, and they are. They're little flattened sacs that are between the bone and tendons so that they don't rub and such. You have synovial sheaths too. You know, your tendons can rub over bones, so your body actually sometimes wraps them in a synovial sheath so they slide over the bone really well. And then like in your knee and your mandible, that's right, in your jaw, you sometimes have meniscus, which is like a padding that helps irregular bones fit together, and you'll hear about people talking about a torn meniscus, and it's a padding between usually in their knee. There is some in your jaw that's very tiny, but these are just other things that we sometimes see inside and around joints that help them not rub on other structures around there and help to pad them, because your joints go through an awful lot of impact. Yeah. Mr. Singletary, please.
Yeah, what exactly is a bursa? Someone asked me that they were going in to have bursa taken care of. I didn't know what it was until I read the chapter last night.
Well, let's look at this picture, because you asked the question at the right time, I'll tell you. This is a Bursa Sac. And note that it looks very much like a synovial membrane, but it doesn't have a joint. It's just a flattened water balloon here. And it's literally here to help this muscle. Hey, what's this muscle up on top here, sir, called, Mr. Singletary? It's a muscle coming from on top of the scapula, hooking to the outside of the humerus.
No, I started to say something else, and what I was thinking of was below the scapula, not on top of it.
It's on top. It's above the spine of the scapula. There must be a name for it. I wish they would have named it above the spine of the scapula muscle.
It's supra.
So that's the above part. I got that. Yeah, supra. That's right, above, and then the spine above the clavicle. But I thought it was above. I thought it was above the spine of the scapula.
Hey, you got me now.
Supra. If only there was a word that sounded like spine. What are the four rotator cuffs, Mr. Singletary?
Okay, think. Hold on. Oh. It's the pronunciation I can't get out.
Well, say it slowly.
Supra.
Yeah. And then.
No, that's not the infraspinatus. That's a super.
Wait, you just said infraspinatus. So just
No,
say
it's not the supraspinatus. That's somewhere else. This is the clap.
Stop. Whoa, stop. It is the supraspinatus. It is the supraspinatus. Supraspinatus means above the spine. Supraspinatus. Supraspinatus.
Actually, I was thinking of the other one.
So, don't, because stick this one in your head. Supraspinatus is this muscle coming up. It's actually the scapula is over here. This guy is up here, and it's going underneath the acromion process. And it's going over here. And remember how I said that it can get irritated here and you can actually get problems here? Well, this Bursa Sac is to actually help lubricate it and help it slide. Help it slide underneath the acromion process. So it's a slippery water balloon that helps it slide under the acromion process in this case, but in other areas of your body it helps it slide over other stuff. That's what it is.
If somebody's having a problem with that, what's going on with that?
Did they tell you they had bursitis?
Mm-hmm.
Well, what does itis mean? What does itis mean?
Inflammation.
Oh, inflammation. So what's bursitis?
Inflammation of the sac. Okay.
Oh, inflammation of the Bursa Sac. I think maybe they have, thank you for explaining this to me. I think they maybe have inflammation of their Bursa Sac.
Okay. All right.
So
is it causing? Well, I guess obviously it must be causing pain.
So usual inflammation, yes, it could be causing pain. It could be swelling, which makes this space get smaller in here. All those types of things could happen. I admit inflammation is a pretty much general term, but it means that there is heat, swelling, irritation in that area. Yeah. And by the way, I appreciate you letting me play with you. I'm not trying to make fun of you. What I'm trying I'm trying to get us but that's going to happen to you all the time. I have people come in all the time. They're like blah 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 itis, and it's something I've never even heard of. But I'm like, oh, well, you must be talking about this then, because I know what itis means and I know what this thing is over here, and you can marry them together. Yeah, good job. Supraspinatus running underneath the subdeltoid Bursa Sac, which I didn't even know existed, by the way. But I mean, I knew there was a Bursa Sac there. I didn't know it was called subdeltoid Bursa Sac. But let's think subdeltoid Bursa Sac. Sub means under, the deltoid Bursa Sac. Oh, makes sense, because guess what's here? The deltoid. It is the sac under the deltoid. Huh, kind of cool. I like Latin. Okay. You've got different types of synovial joints. I won't go into these really heavily because you guys did them in your trail guide. But remember, the joint type tells you what it can do. My elbow, which is actually called my humeral ulnar joint, is a hinge joint. It actually can't go side to side. Why am I able to go side to side? Because of my ball and socket up here. Thank you, Miss Everson. She's like, it's up here, dude. If I lock this down, I can't go side to side. It's a hinge. It does what a door does. That's it. And the reason we care about joint types is they give us an idea of what's going to happen when we move this thing. I know when I hit my shoulder, it could do all sorts of stuff. But I know if I hit my elbow, it's either going to flex or extend. That's all it can do all day long. So, hinge joint, excellent example would be your elbow. A pivot joint, I can actually only think of one. It's between C1 and C2, and it allows me to do this. Rotate. I'm literally rotating on a pivot in there. Yes, Miss Carrillo, please.
I'm sorry, I know we covered this before, but I've already forgotten. Why is ankle there? Because it feels like it goes around under the hinge joint.
Why is ankle? Well, where is elbow and ankle? Maybe it's not a good example. I mean, these are made up things that somebody has now categorized your whole body with. But I would suspect some of the going around is coming from other joints underneath the ankle joint. So here's what I mean by that, Ms. Carrillo. Your tibia you haven't learned this yet. So you're right, I went over this briefly, but do not apologize because most people need to hear things 6 times before they learn them. So that's fine. I'm aware that I'm repeating myself to all of you. I'm not that old. So, but I figure you have to hear things 6 times by the end of class to actually have it stick. Anyway, your tibia comes down and it meets this bone, this fairly small bone called the talus. This is where your ankle forms. And that acts like a hinge joint. But underneath the talus is the carpals, and all those carpals are kind of like the wrist bones for your feet. And I suspect that's where a lot of the rotation is coming. I want to add one caveat to that, which is also if you had a loose elbow, it would have a little bit of back and forth roll to it, or if you had a loose ankle, it might have some roll to it too. But I really think they're talking about the true ankle joint, which is the tibia meeting the talus, and that only flexes and extends. Really, we'd say plantar flex and dorsi. Yeah, go ahead.
And that's why the wrist isn't like the ankle, as in like used as an example as a hinge joint because it meets a bunch of carpals, right?
Yes, and the wrist really can. The wrist has a whole bunch of what they call gliding joints, and it's got 8 bones that can just kind of glide over each other, and when you get enough gliding joints together, they can act like a ball and socket, kind of like. But that's because I've got 8 joints in here kind of gliding around, yes.
Versus the ankle that meets another bone.
Another bone, and just plantar flexes and dorsiflexes, which is just like a hinge. I don't think it's a great example, but that's why. Saddle joint, you guys have a saddle joint in your thumb. Saddle joints are really cool. They look like a saddle on top of another saddle, like an upside down saddle on top of another saddle. And so one can wiggle this way and the other one can wiggle this way, and that allows you to look like you have a ball and socket in your thumb, like Miss Everson. But she's not doing that because of a ball and socket. She's doing it because of 2 saddle joints. And the one saddle joint lets her go this way, the other one lets her go this way, and you put all that together and you get some really cool stuff going on. Yeah. Condyloid or ellipsoid joints to me are very much like sliding joints. And Miss Carrillo, just to confuse you further, they're not actually talking about the carpals in here. They're talking about where the carpals meet the radius. And the radius has this little ellipsoid, little egg-shaped, little teaspoon-shaped thing, and they're gliding in that, and they call that an ellipsoid joint. And actually, a lot of the reason I get all this movement out of my wrist is I have gliding joints and ellipsoid joints all working together. You got like 20 joints in your wrist, if you want to get technical. Here's the gliding ones. And then, of course, we know about ball and socket. The best one is your hips. The worst one is your shoulder, just because there's not much of a socket. And here are little pictures of all of these in your book. We've already learned about crepitus, right? Crepitus, no pain, lots of noise, creaking and cracking in your bones. Oh, they attribute it to nitrogen too. I've heard this too. Nitrogen gas kind of in your joints and such. And it is not bad. I'm not going to talk about, not because, by the way, you should know it all now. I know we're still kind of getting confused with flexion and extension, but I don't want to spend too much time on them. But flexions normally happen on which side of my body? Miss Hendrickson, please.
Usually in the front, except for the knees and the feet, right?
Thank you. That was beautifully done. Yeah, feet are just weird. They decided to call plantar flexion dorsiflexion. It upsets me, actually, because they're both flexions, right? You just have to kind of remember. But you said it really well. Flexions normally happen in front of my body. I am now flexing, or you're heading to the front. By the way, just look at my arm here. I could be flexing right now. We don't know yet. The minute I start moving towards the front, I am in a flexion. I'm heading towards the front. And strangely enough, I know I'm front now, but we'd still call this a flexion. I'm going more front, even though I'm not really. So flexions happen in front. Do they? Yes, they do. Flexions happen in front. Extensions happen where? Yes, behind me, except for the darn knee again. And I always remember leg extensions at the gym, where you kick your legs out. That really helps me remember that. But extensions normally happen behind me. Do they? Yes, they do. Good. Hyperextension is obviously the idea of going beyond a joint's normal range of motion. If somebody's hyper flexible, they can hyperextend certain joints past what we normally would be able to. That flexion and extension, even though it's not true for the ankles, we still consider it with the toes. Bending the toes under, flexion, sticking them out like your legs on a leg extension machine would be extension. Do-do-do, boop. Abduction and adduction. I don't know why adduction is not on here, but abductions are usually moving in what direction? Think about that. Abductions are usually moving in what direction? And what do you call that, Miss Everson? I know, that's tricky.
I want to say abduction, but I'm assuming it's not the answer.
But like, if you're absolutely right, by the way, you got it. The question I'm asking is tricky because it's hard for me to ask it without giving away the. But what do we call when things move out to the side?
Moving away from mid.
Yes. What do you call it when you move away from midline besides abduction? Abduction is the correct way to describe my arm going out. But like right now, I'm moving out to the side. What kind of movement am I doing? Besides ridiculous.
I do not know.
It's not medial, it's
Lateral.
Mr. Singletary. You just spoke right up. Out of your turn.
Lateral.
You're cut off. Thank you. It is lateral. So yeah, but Miss Everson, you're absolutely right, by the way. This is abduction, and they tend to move out laterally. Whereas adductions bring us back to the midline and our medial. Yeah.
So a lateral abduction is basically just the same thing twice.
Yeah, and I feel bad actually about bringing it up now. Call it abduction. I just was trying to point out that that is a lateral movement, right? It's going away from my midline. Whereas medial movements are adductions. They're going back to my midline. Yeah.
Okay.
Stick to abduction and adduction. But we will use terms like lateral and medial, and that's how you were pointing. You were pointing laterally, and you are pointing medially. That's what kind of popped in my head. They also talk about radial deviation. That's where your hand moves away from the midline. This one is a little tricky, by the way, because you have to put me in anatomical position. So that's an abduction, and that's an adduction. I have to be in anatomical position. And some people call that radial deviation, but we usually refer just to abduction and adduction of the wrist. We usually use the word deviation for our jaw. We already talked about adduction, moving back towards the midline. Opposition, the only example I can think of opposition is this. Pinky and thumb going across your hand. Reposition is when my thumb comes back across. Opposition, reposition. Humans are not the only animals can do this, but very few animals can do this. And it's one of the reasons we can use tools. There are primates that cannot do this. And when they go to pick up something, they'll pick up a pencil like this, because their thumb only abducts and adducts. I gotta do it. It only does this. Their thumb cannot oppose. So they can't wrap it around something. They only do this. And when they go to pick something up, you'll see them do this. It doesn't occur, they can't do that. Mr. Craven.
So they don't have a hinge joint, it's like some other kind of joint?
They don't have a saddle joint. They don't have the two saddle joints, yeah. And so they probably have a hinge joint, I honestly don't know, but they probably have a hinge joint, and they can only do this. And it's interesting because you'll be at the zoo and you'll realize, like, why is this intelligent creature grabbing like this? They really can't use their thumb like that. Yeah. Ms. Hendrickson.
Are we the only ones that have done this? Or
No.
there are some primates that can use
There
it?
are some that can do it, yep. We're not the only, we're not the only ones, but there are very few. And I wish I knew which ones, and I don't. I'm still learning human anatomy. I really haven't graduated to zoology yet. Yeah, Mr. Ma. Sorry, sir.
Yes, our question. My joints crack a lot.
Yeah.
It is normal.
Does it hurt?
Doesn't hurt.
Then it's normal. It's normal. It could even be a good thing. So Mr. Ma is saying, hey, my joints crack a lot. Is that a bad thing? If it doesn't hurt, by the way, every doctor out there says, no, it's fine. But the other thing is it's possible that they're popping because your joints are nice and loose. And when they're nice and loose, they can click by a lot of stuff. They can, sometimes when they're tight, they don't make a lot of noise at all. So it could be even it could even be a good thing, sir. But yeah, it's okay. I mean, we've already pretty much figured out you're perfect in every way, Mr. Ma. I don't even know how you could doubt that. Really. I mean, come on. I wish my joints cracked as much as yours. All right. Alder deviation. This is that adduction, abduction thing. Ulnar deviation means it's moving moving towards the ulna. Don't worry about that. We still call this adduction and abduction of the wrist because I'm in classical position. But ulnar deviation means moving towards my ulna, which is this bone here. Radial deviation is moving towards my radius. Occasionally I hear massage therapists talk about that. We will go over this again. Don't worry, this will not be the last time we talk about this stuff, so don't feel like you have to absorb it all. At all. Oh, I love this classic one though. Adduction, abduction. For your hand, we pretend like your hand's got its own midline. And we say, I'm moving away from the midline of my hand. I'm moving back to the midline of my hand. Abduction, adduction. Right? Right, of course. We've already done horizontal adduction. If I'm out to my sides, pretend like I'm a seal. This is adduction, abduction. Adduction, abduction. Horizontal though. All of it's horizontal. We did opposition. Circumduction is when we get crazy. The examples are always with the hips and always with the shoulders because you need a ball and socket usually to do circumduction. There is one exception to that, which I think is the thumb. Well, actually there's a couple. The wrist really can do circumduction, but it's not a single joint doing circumduction. These are single joints doing circumduction. Your wrist is using a whole bunch of joints to do circumduction. Miss Carrillo, please.
I just thought of it. When you said horizontal abduction and adduction, is there a vertical? Would that be like that?
You just did a flexion.
Oh, okay. I got it. Thank you.
Yeah.
Okay.
No, don't ignore you. I love these questions. I like this kind of thinking. But yeah, no, the horizontal, if you think about it, it is actually moving back to this imaginary midline plane that runs through me. Boom. Yeah. We have rotations, left and right rotations. Remember, they're according to the client. This is my right side. This is my right rotation. It doesn't matter how you're looking at me or where you stand. It's where the client is. It's all about the client. We've talked about upward and downward rotations of the scapula. By the way, little important note for the test at the end of the year. The test at the end of the year will definitely ask you about movements. They're just so key to kinesiology. And this guy right here, you'll see a picture of something like this, I suspect, if I recall. It's honestly been a long time since I looked at the test. But it always throws people off that he's got his elbow bent because they think that's part of the thing. The only reason they bend his elbow is so you can see that he's medially and laterally rotating. So it throws people off because they're like, oh, is it a flexion or extension? No, it's none of that. They're trying to show you an arrow going here to let you know he's medially rotating, or an arrow going this way that he's laterally rotating. So don't be thrown off by the bent elbow guy in the final at the end of the year. And it's just the way they always show medial and lateral rotations. So just letting you know that. And by the way, they can get tricky with it. They can have a guy with a bent elbow like this. That's a lateral rotation and that's a medial rotation because if you put me back in anatomical position, it's the same thing. But that's what it's all about. Yes, Miss Dimitri.
That arrow's going both ways, so is it just pure rotation?
Yeah, they're showing, yes, pure rotation. Thank you. They're showing lateral and medial. That would not be a test question.
But if they had it just one direction,
yes,
then it would be...
Yes, yes. And that's how it would show up on a test. It'd be that with the arrow only going one way. And if it's heading towards his body, medial rotation. If the arrow's going away from his body, lateral rotation. Yeah. A little rotation in the ankle, scapulas. Oh, we all know this, right? Pronation, supination. Boom. We know the game that your uncle always gets to play with you before he slaps your hand. I don't know, it's always an uncle. Feel like it. He's like, you want to play this game? You're like, yeah, sure. Yeah. Pronation and supination. Supination, I could be holding a bowl of soup at the end. Pronation, I'm prone to dump it out. Soup. Prone. Boom, boom. Plantar flexion and dorsiflexion. Dorsiflexion is when you are letting off the gas. That is actually possible for some of you. I've watched you drive. You actually can let off the gas. It's okay. Anyway, dorsiflexion, you let off the gas, and I remember it because you could stop a door. Like when a door's kind of opening up at you, kick up your foot and stop the door. Plantar flexion is how most of you drive. You just plant that thing to the ground and just go. Plantar flexion, pointing your toes down. Inversions and eversions are important too. We will use them when we look at structural anatomy. Everybody, not everybody, most people walk on the insides or outsides of their feet. If you have a pair of shoes that you've worn a lot, look at the bottom of it. If the outside edge is really worn, you probably invert. You probably have the soles of your feet coming in to meet each other, and that's why you're walking on the outsides. If the insides of the sole are worn, you probably put your feet out and you are everted. But anyway, the way I remember these is the soles of my feet. If the soles of my feet are starting to look at each other, they're looking in at each other, inversion. If they're looking away, eversion. Yeah. And we do care about that because it tells us, because the feet are the foundation of the body. Come on. Really should have just had a whole 700-hour course on feet. Miss Osuna, please.
2 questions about this.
Yeah.
Can this be like fixed in any way? And then also, does this affect like our hips and the way we walk and like other areas that probably cause problems?
Yes and yes. Yes, so it can be fixed in the sense that muscles can be loosened up and stretched that might be causing you to invert or evert. Other muscles can be strengthened that would help you to stop everting or inverting. And 100% does this affect your hips and everything above them. This could affect your knees easily, probably does. It could affect your hips, and once you affect your knees and your hips, you could probably blame everything else above there on that too. Headaches, bad hair day, anything. It could all be because of your feet everting or inverting. So absolutely yes and yes. Elevation, depression. Protraction, retraction. We've been talking about it with the scapula. Super confusing. But I can protract my jaw or retract my jaw. I don't have a lot, but protract, retract. By the way, when you actually use your jaw, you don't just hinge joint it. You actually protract and retract a little bit every time. We have very complex jaws. We'll get to that when we get to the temporal mandibular joint. Okay, and here's retraction or adduction. Here is protraction or abduction. Beautifully said. Excursions, I've always heard this called lateral deviation. Lateral deviation is when your jaw goes to one side or the other. Some people are really good at it, moving their jaw back and forth side to side, but lateral deviation is when your jaw deviates to the side. Not a good thing in general. It's not bad if you can do it. It's bad if it stays that way. Okay. Oh my gosh, we've gotten to that time again. We've got to do pathologies. And by we, I mean you. Okay. So we went backwards this time. I hope you're all paying attention. Don't email me later and say, what's my pathology? Because I'll say you weren't paying attention to my lecture. So listen up, everybody. These are these small, beautiful presentations that you do. Remember, 2 minutes. Don't kill yourself. But give me more than a sentence. I want a good, solid paragraph on what this thing is. Miss Young is going to be very kind to tell us about adhesive capsulitis. Thank you very much for that, Miss Young. I do appreciate that. Mr. Thornton is going to be telling us about Baker cysts. Excuse me. Miss Stevens is going to be telling us about bursitis, which Mr. Singletary and I were actually discussing earlier. But Ms. Stevens is going to tell us all about bursitis. Excuse me. Mr. Snell is going to tell us about dislocations. Don't know what the problem is. Dislocations and subluxations. Thank you, Mr. Snell. Dislocations and subluxations. Mr. Singletary, fractures. I want to know all about fractures. Ms. Savarino, sprains. Woo. Mr. Richards, ganglion cysts. That says cyst, that's one, but ganglion cyst or cysts. Miss Rader is going to tell us about gout. Can't have a discussion about joints without talking about gout. Good stuff. Mr. Lee. Mr. Lee, you're going to tell us about kyphosis. And Miss Lee, you're going to tell us about lordosis. Miss Pugh, scoliosis. Got a lot of isses here, huh? Mr. Overman, Lyme disease. Miss Osuna, osteoarthritis. Mr. Manzanares, rheumatoid arthritis. And Mr. Ma, osteoporosis. Osteoporosis. Sorry, I missaid that. Too many words. Osteoporosis. Mr. Jones, patellofemoral pain syndrome. What the heck is that? Patellofemoral pain syndrome. All right. Boom. Miss Hendrickson, spondylitis. Miss Green, this is a big one, Miss Green.
Wait, you said spondylitis, but it says spondylosis.
Oh!
Is it spondylosis?
No, it's spondylosis. I said it wrong. I don't think there is. I don't know. Maybe find out if there's a spondylitis with that, but I think I just blew it. Spondylosis. I think I've probably been saying it wrong this whole time, my whole life. Right. Miss Green, you have temporal mandibular disorders. Temporal mandibular disorders. This one's big, Miss Green, because you will get lots of clients, all of you, that come to you with temporal mandibular disorders, and massage is actually a good treatment for them, so it's worth talking about. Mr. Godot. Mr. Godot, in case you're on the phone and you can't see this, listen up carefully. Bones and joints of the shoulder girdle. Bones and joints of the shoulder girdle. So what am I asking there? He's helping us review. Just tell me all the bones and all the joints, not a very heavy lift, of the shoulder girdle. Miss Eversole, muscles that move the scapula. So that means they probably attach to the scapula and somewhere on your axial skeletal system. And they move the scapula around. Miss Everson, muscles that move the humerus. So these would be muscles that attach the humerus to the scapula, or the humerus even to your axial skeletal system. And you're just listing them off, and and knowing that they attach and they move the humerus. I might ask you how they move it, but still, that's about it. Mr. Bose, you're going to review regions of the body for us. Regions of the body are things like, this is my brachial region, this is my cranial region, this is my carpal region, this is my cervical region. So you're helping us do some review here so that we don't forget stuff. Ms. Dimitrik, you're going to demonstrate planes of movement. There are 3 planes of movement. When I say demonstrate, I don't know how. Please don't, I'm not setting you up to fail, but just kind of, we're reviewing. So there were 3 planes of movement. Try to, I don't know, slice an apple or just use your hands or whatever. Miss Deng. Miss Deng, I want you to help us review actions by demonstrating them. So Miss Deng, you would show us flexion, extension, abduction, adduction, circumduction. You will show us that. Just show us that, Miss Deng. You'll say the word abduction, adduction, flexion, extension. I hope that makes sense. And we've got more, I believe. Mr. Craven, you got bone spurs. How can we talk about the skeletal system without talking about bone spurs? What is a bone spur? What causes a bone spur? Is it actually made out of bone? Is there a spur in there? Why is there a spur in there? Miss Clayton, I'd love a quick summary of the integumentary system. This is so we don't forget everything we learned last week. This is just review. That's why we're doing it. So a quick summary of the integumentary system. I am not expecting you to, give us 4 pages on an entire chapter. Just, like what makes up the integumentary system, like the anatomy and physiology of it. What are the main parts and what do they do? Miss Carrillo, I would love it if you would give us a summary of the skeletal system. I'm laughing because Miss Carrillo is like thinking right now, should it be a motion picture? Do I need extras, props? I don't know. Please don't kill yourself. I mean, do whatever you want. You guys are all amazing, but I just meant I'm not expecting I just talked for 3 hours on the thing. I'm expecting you to talk for 2 minutes on the thing so we don't forget. What makes up the skeletal system and what does it do? That's it. Miss Abelos, are you there? Dear Miss Abelos, let me stop sharing so I can see you. Miss Abelos, dealer's choice. You love to teach. I don't know if this is a nice thing or a mean thing. And by the way, I'd be happy to do this for anybody. I'm not trying to favor Miss Abelos, but she loves to teach. She's adorable about it, and not that you all aren't. And I thought, dealer's choice. Teach us anything. It'd be nice if it kind of had something to do with the skeletal system, but guess what? I'm not going to micromanage you. If it is even remotely related to the human body and massage at all, I'm good with it, right? If you want to give us a session about better hygiene of the teeth that happen to be bones, I am cool with it, all right? It is supposed to be fun. And by the way, if any of you are like, I want those kind of options, send me an email. I promise next time it'll be dealer's choice for you. I thought it was a cute fit, and I was running out of stuff to assign. So that's why I did it. Ms. Dimitrik, please.
I didn't see sprains in your list.
You
Which is in the book.
Didn't we have sprains? I think we had sprains. Hold on, I'm looking right now. Yeah, Miss Savarino's doing sprains.
Alright, sorry.
No, don't be sorry. I need the help. You
I
guys
just
need...
thought it should come after that spondylolysis or whatever.
Yeah, it should, but it didn't. So, yeah. Things get mixed up in the serving it up. All right, everybody. So, good news is you've got 30 minutes, and you have that homework assignment and one tiny quiz, and that's it. Very much like the last time. Here, hold on, I'm checking right now. So you do need to prepare for tomorrow, but you have just a 10-point quiz on the skeletal system for tonight. And that's going to show up here in a second. And you've got about 30 minutes to kind of work on this stuff, which is hopefully helpful. So bear with me. Let's activate all this stuff in the system. Yeah, Mr. Manzanares.
So we do the same thing for last time, the same thing?
Yeah, exactly, sir. Well put. You do the same thing for last time. And guys, I was really impressed last time, and no buts about that. I was impressed last time. End of sentence. But I also don't want you to feel like, I know you guys have jobs. I know that you are coming to school here. I know that you are doing other homework. I know that you spend a lot of time. It is fine just to literally deliver a clear, cohesive paragraph. It is also fine if you have fun and you want to put on a musical play that explains the entire human body. That's fine too. I don't want you to feel limited, but I did not look at people and be like, oh my gosh, you know, what Mr. Ma did was great. He literally was like, I memorized this paragraph in the book and I'm going to tell you guys about it. Beautiful, right? So all over the place, it's fine. But we just want to walk away and be like, oh, yeah, if somebody asked me what spondylitis was, I now can tell them. Like, I don't understand it like a scientist, but I understand it. So please I don't want to stress you guys out. I worry about that sometimes. But yes, Mr. Manzanara's exact same bat time, same bat channel, same bat assignment. And sorry, I'm getting to the last class here to release the homework. And the homework is get ready for tomorrow to do this. That's super important. But you have a 10-point quiz, number 18 on the skeletal system, and that's it. And the rest of this time is free time to work on that good stuff. So